Hi, I'm Kirsten Tyler, and today I'm going to be presenting on Leig's disease. So for starters, I'm going to show my prop that I created. I created a human cell. The reason that I created this was because I'm going to show you some anatomy of one of the causes of Leig's disease, which is a mutation in the mitochondrial DNA. So right here is the mitochondria. And within the mitochondria lives the mitochondrial DNA, and they are small chromosomes that are found inside the mitochondria within a cell. So that is this. And mitochondria is known as the powerhouse of the cell because it primarily creates and produces energy for the human body. Okay, now let's get into my presentation on Leig's disease. Okay, so for the diagnosis and brief description, Leig's disease is also called subacute necrotizing encephalomyelopathy. It's an inherited early onset progressive neurodegenerative and neurometabolic disorder. The neuropathology consists of focal bilateral lesions in one or more areas of the central nervous system, including the brainstem, the thalamus, the basal ganglia, cerebrum, and spinal cord. To the right, I have placed a picture to highlight some of the anatomy in which Leig's disease affects. So specifically, I have the thalamus, the brainstem, and the spinal cord boxed. And Leig's disease can be diagnosed through MRIs, CT scans of the brain, and also through genetic testing. On to the etiology. There are three types of Leig's disease. There is infantile necrotizing encephalopathy, adult onset subacute necrotizing encephalomyelopathy, and X-linked infantile necrotizing encephalopathy. The precise metabolic defect in Leig's disease is actually unknown. However, it can be caused by mutations in the mitochondrial DNA or by deficiency of an enzyme called pyruvate dehydrogenase, and the most underlying cause is a defect in the oxidative phosphorylation. And then I've placed a picture of a cell that highlights the mitochondrial DNA, which is found in the mitochondria of a cell. Now on to the pathophysiology. Leig's disease affects symmetric areas of gray matter, necrosis of the putamen, thalamus, hypothalamus, dentate nuclei, cerebellum, and optic chiasm. The neuropathology again consists of focal bilateral lesions in the central nervous system, including the brainstem, thalamus, basal ganglia, cerebrum, and the spinal cord. And these lesions are areas of demyelination, gliosis, necrosis, spongiosis, or capillary proliferation. So now on to signs and symptoms. There's a lot of signs and symptoms involved with Leig's disease. However, I chose to focus on some of the more common ones. The clinical symptoms depend on which areas of the central nervous system are involved. They progress very, very rapidly in Leig's disease. And the earliest signs can be poor sucking abilities, the loss of head control, and also motor skills. The neurological deficits involve ataxia, which is trouble coordinating voluntary movements such as walking and running, bulbar paresis, abnormal ocular movement, visual disturbances, and regressive psychomotor development. And progressive symptoms include generalized weakness, poor muscle tone, and also episodes of lactic acid, which can lead to impairment of respiratory and kidney functions. Now on to the prevalence. Leig's disease is a rare progressive neurodegenerative disorder of the pediatric age group. It affects approximately 1 in 100,000 to 1 in 140,000 births. 80% of the cases are of the infantile onset type, and the infantile onset type affects approximately 1 in 36,000 to 40,000 live births. Approximately 50% of affected individuals with Leig's disease die by the age of 3 years, and it's most often a result of respiratory or cardiac failure. The onset of Leigh's disease decreases with age. Long-term survival may occur with later onsets in adulthood. However, this is really rare. Late onset with partial deficiencies could have a lifespan of about 6 to 7 years, but again, this is very rare to see. Related populations and lifespan considerations for Leigh's disease. So, this disorder generally begins in infants between the ages of 3 months and 1 to 2 years. This rarely occurs in adolescence or adulthood, and some lifespan considerations include developmental delays, motor skill deficits, neurological deficits, visual deficits, psychomotor deficits, and also impairment in function of other body systems. Okay, so related disorders and or risk factors. So some related disorders to Leigh's disease include dorsal midbrain syndrome, hypertrophic cardiomyopathy, anemia, renal tubulopathy, epilepsy, which causes seizures, peripheral neuropathy, and hypertrichosis. Some risk factors include genetics, and gender and race are not seen as risk factors in the infantile onset. However, in the adult onset, it affects twice as many males than females. Medical management of Leigh's disease. So, there is currently no cure for Leigh's disease, so managing and treating symptoms is the main goal. This may include management of acidosis with drugs, anti epileptic drugs, and select drugs for nutritional and psychological support. Individuals with X-linked Leigh's disease may be advised to follow a high-fat, low-carb diet. And there are currently no proven therapies for this disease, but the care of these individuals is usually in the hands of a team of specialists like pediatricians, cardiologists, neurologists, audiologists, eye specialists, and also physical therapist and occupational therapist. Okay, so some condition related precautions for Leigh's disease include genetic testing, taking vitamins and supplements for nutritional health support, exercising as able to increase muscle tone, and also conserving energy because these individuals tend to have low muscle tones and generalized weakness throughout their body, which may cause excessive fatigue. So, conserving their energy will allow them to participate in their daily lives at a more functional rate. Now, on to medical treatment. Because there is no cure for Leigh's disease, doctors and medical teams primarily focus on treating the symptoms throughout the course of Leigh's disease. The most common symptom treatment is thiamine, which is vitamin B1. Oral sodium bicarbonate or sodium citrate may also be used to manage lactic acidosis. And there's current research with dichloroacetate and its effectiveness to treat the symptom of lactic acidosis as well. And there also can be a use of anti-epileptic drugs for seizures, drugs for nutritional and psychological support, and or aimed at preventing the onset of cardiomyopathy like gabapentin and baclofen. Okay, so evidence-based practices related to the OT services. So OTs can help these individuals in many ways with managing and treating their symptoms. However, I chose two interventions, one that focuses on visual disturbances and the other one that focuses on motor skills. So, for low vision interventions, the OTs can evaluate and address the following: acuity and need for magnification, so implicating devices like magnifying glasses and or increasing light to promote participation in occupations. Contrast sensitivity function, so increasing contrast or light to promote visual functioning. The amount of movement in a visual task, so teaching these individuals visual scanning skills to enhance tracking of moving objects and paths in which the client may move in within different environments. For motor skill interventions, the OTs can implement certain aspects into therapy to improve and develop motor skills. Some include, but are not limited to, preparatory activities designed towards providing vestibular and proprioceptive input, as those specific inputs enhance muscle tone, which will further improve motor skills. They can implement graded motor practice where the OT will design appropriate but challenging tasks that the client will succeed in, like cutting and writing. And then also using play and peer interaction for a type of intervention, as this can increase effort, attention, and enjoyment within the activities that enhance cognition, emotions, and also motor skill development. Okay, so occupational performance areas impacted by Leigh's disease. So, primarily, all areas of occupational performance are impacted by Leigh's disease. Um, just a few specifics. So, ADLs, poor sucking affects eating in the early onset. Weakness and poor muscle tone, visual deficits, and ataxia may affect bathing, toileting, functional mobility, hygiene care, and sexual activity in the later onset. For education, dysarthria, loss of motor skills, ataxia, visual deficits, poor muscle tone, and regressed psychomotor functions may affect mental and physical performances that are demanded in the school setting. Play, loss of motor skills, visual deficits, poor muscle tone, weakness can all affect play exploration and participation in both onsets. For social participation, visual deficits, dysarthria, regressed psychomotor functions may all affect socializing within the community, with friends, and with family in both onsets. The body functions that are impacted are mental functions, sensory functions, neuromuscular, movement-related functions, cardiovascular and respiratory functions, voice and speech functions, and digestive and metabolic functions. Motor skill wise, coordinating, transporting, moving, enduring, walking, and lifting are all affected as a result of the complete loss of motor skills and or poor muscle tone, weakness, and ataxia. Social interaction skill wise, producing speech, speaking fluently, emotional expression, replying, looking, and clarifying may be impacted due to dysarthria, visual deficits, and regressed psychomotor functions as well. The performance patterns, habits, routines, roles, and rituals are all impacted by motor skill deficits, neurological deficits, visual deficits, psychomotor deficits, and also impairment in the function of other body systems. And then for context and environment, all the environments, so physical, social, personal, virtual, and cultural, are all impacted by the visual deficits, the dysarthria, ataxia, poor muscle tone, weakness, regressed psychomotor functions, loss of motor skills, and also the respiratory and cardiovascular problems that come along with Leigh's disease. And these are my references. Okay, so for my activity, we're going to be playing Leigh's disease trivia. I have questions worth 1 point, 2 points, and 3 points. And the girls are gonna pick their question, and then I'm going to read it to them, and then they are going to answer as I keep score. So here's my contestants, Ariel and Claire.
Hi.
And here is the setup. Okay, let's get started. Okay, Ariel, you can start.
A 1 point question.
Okay, is there a cure for Leigh's disease?
No.
Correct. Claire?
I'll do 1 point.
What is affected with Leigh's disease?
Central nervous system.
Correct. Ariel?
2 points.
What is the main focus with treating Leigh's disease?
Treating the symptoms.
Correct. Claire?
I'll do a 1 point.
Which onset is the most common within Leigh's disease?
Infantile.
Yes. Ariel?
2 point.
Does the onset of Leigh's disease increase or decrease with age?
Decrease.
Yep. Claire?
I'll do a 3 point.
What is one drug that may be used to manage symptoms of Leigh's disease?
An anti-epileptic drug.
Yes. Okay, we are late in the game now, and we have one question left to determine the winner. So, Claire, the last question. When does the disorder generally begin?
3 months to 1 to 2 years.
Correct. Claire is the winner. Woo!
Thanks for watching.